Welcome to EFT Nation, your home for all things tapping. For show notes and resources, please visit EFTtappingtraining.com. We are your tapping hosts. I'm Alina Frank.
And I'm Craig Wiener. The information provided in this podcast is not a substitute for counseling or medical advice. The information presented here is meant to inspire and educate listeners, but are not guarantees of any kind.
Okay, so today we're going to be talking about the science of EFT. And boy, I really didn't give two hoots about the science for the longest time. I mean, thinking back at like the first few years of my practice, I was of the mindset of, here, let me go show you, do you need some help with that? Let me go in a back room and teach you this thing. Let me tap on you. And so it really wasn't that big of a deal to me. And then I realized that I really did want to do like hospital outreach programs. I really did want to sound intelligent. I really did want to build a bridge. And we talk a lot about that in our trainings. Like so meeting the listener where they're at. And for a lot of people, science is the best way to actually get that hook and that interest. And so when I met Craig, who loves science, it was just a natural fit that I would pay attention more. And that's really what led to, all kinds of things that we've done. There is a great resource on our website, EFTtappingtraining.com, and it has most of the scientific research, because one day I said, can you just write like notes for somebody like me that really doesn't have a science brain, and where you could do some notes on like the bottom line. I can't read an abstract and really know what the heck that means. So you really did a wonderful service to the EFT community and to me personally. That you just sat down and you said, okay, I'm going to look at each study and I'm going to just bottom line it with a paragraph. So we did that. And then we didn't think it was enough because we were out there teaching EFT coaches and practitioners how to market their business. And we soon realized that there was really a need for a sort of documentary film or bite-size pieces of the science in a visual, form that it would really sway audiences. And that's when we went down the rabbit hole of discovering how to do a documentary. And so we came up with the science of tapping, and you can check that out at scienceoftapping.com. But I really think that just knowing like a few things is really helpful to everybody out there, whether you're doing it for yourself and you just need, should I even bother trying this? Or a practitioner who's trying to talk to an audience or convince a client or a potential client. So, Craig.
Yeah, what I want to say is, you began with building that bridge for those people that are interested.
Yeah.
And I was one of those, because when I first heard about EFT, it sounded too good to be true.
Right.
And it sounded ridiculous, and
right.
I just kind of pushed it away.
Right.
It sounded woo, too good to be true, all of that. And it really was investigating the science behind it a few years later that allowed me to be able to start to have a listening ear for this. So, and that's for me, and to really have EFT show its effectiveness in places like addiction centers, in hospitals, in the VA, in places where health care is being administered.
Right.
It's going to be a requirement to be able to have that for a listening, to be able to have committees and be able to accept EFT into those kinds of paradigms.
Yeah.
So it is really important. And, we all know, anybody that's really familiar with EFT knows that EFT is used to change distressing or negative feelings, to alter self-limiting thoughts, to stop or reduce unwanted or unhealthy behaviors, and instill positive flips of that, right? So I thought that I would just start off with a couple of the definitions from the literature, from the research, to say what EFT is.
Great.
Right. So David Feinstein says, what it is it's a clinical and self-help modality that combines verbal and physical procedures for affecting therapeutic change. And that's accurate.
Yep.
Right? If you look to some of the definitions by Dawson Church, he'll say clinical EFT is an evidence-based practice that combines elements of exposure and cognitive therapies with the manual stimulation of acupuncture points. Okay, so this is, a more scientifically research-oriented definition. But again, what you said, we need to find, depending on who we're talking to, how we best describe that.
Sure, but even if we just memorize those statements or use those statements in like our website or marketing material, I think that's very helpful.
It can be, sure. And what we start to understand is EFT is a cognitive and energetic and somatic modality. So, as far as how it affects the body, I'll talk more, but studies show how it affects brain waves and hormone production and blood flow to the brain and gene expression. So it definitely is a somatic modality. Also, that is, intimately involved with manual stimulation on the skin. So there's a lot of body-oriented focus to it. We also know that EFT produces rapid results. Okay, and I'll go over some things with that. And it can also change deep emotional learnings and memories, for example, associated with trauma. And, at this point in the early 2020, when this is being recorded, we now have over nearly 120 published studies about EFT, over 52 randomized controlled trials, 5 meta-analyses, hundreds of case studies with EFT showing it to be effective in everything from a whole list of things: phobias, anxiety, depression, weight and food issues and cravings, pain, fibromyalgia, sleep disorders, headaches, athletic performance, and we could keep going. So for a really broad range.
So before we go on, can I ask you a question?
Yeah.
I am, again, not science brain. What is... So 118 published studies. So is that important that studies are published, and is that what people are looking for as like a thing that they would say
it's a definite thing, right?
Okay.
And and since EFT was started around 1985, the numbers of studies keep growing.
And
the
so
quality,
randomized
let me
trial
back.
and meta. Let's just do one sentence on each.
No, I'm going to go back and I'm going to just go ahead and start and kind of give an overall. Okay. So what we're looking for is an improvement over time. With EFT being done, studies improving in their quality, in their scope, in where they're published in better and better journals that are, for example, on Medline, etc. So early studies were weaker when they first started, and they're improving over time. And there is a whole hierarchy of different quality studies. So like what you said, what we're looking for is well-done randomized controlled clinical trials. Right? This is very high because that's saying that we're having one group of doing EFT, another group controlled doing something else.
Sure.
They're blinded. We're ruling out things, and so we're really focusing.
There was one randomized controlled trial when I started my practice.
I don't know.
Yeah.
I'm not
so
sure
now
where
we're up to 52.
So we're up to 52 now.
And then.
Okay.
Meta.
So there are a lot of important studies. Okay. Some that, for example, dismantle and show which parts are effective about EFT. Other ones that are trying to understand the theory and the mechanisms for how it's working. When there's enough trials out there, there's something called a meta-analysis that then starts to look at all those different trials and then get kind of a meta perspective on ruling in the ones that were of higher quality, etc. So the meta-analysis is actually an analysis of the studies that were done. And we now have 5 of them.
Okay.
And they include evaluating, for example, depression, anxiety, PTSD, because there's enough studies done for each of those to do a meta-analysis.
Right.
Okay. And I know that there's one that is going to be beginning this year on looking on the EFT on it's going to be a somatization, but really the body-based physical complaints studies. So that's going to be done in the next year, or evaluated this next year. So we're looking at this broad range. I mean, just imagine for a second. It's one thing if you're looking at, let's say, a drug, for how a drug affects one particular condition. And that can take years to really get a firm, solid base of support. But the challenge is we're looking at EFT for everything, for so many different conditions.
Right.
And every one of those conditions ideally has many studies for each condition. And we don't have, at this point, large funding grant of National Institute of Health. We don't have big pharma supporting us,
Yeah,
or
that's
large
a
organizations
problem.
that are giving a lot of money.
Yeah. So I'm really proud of us for supporting the science, and we have contributed to a bunch of these studies with the sales of Science of Tapping and some of our live events. We've given a percentage to the science.
Yeah.
Okay.
So one of the things I do want to say is considerations are, how safe is EFT?
Okay.
Right. So one would often look to, have there been any studies that show adverse clinical effects of EFT? There's none. There's not one single study showing adverse effects of using EFT in a clinical setting.
Wow.
So that's really excellent.
That is impressive.
When we start to look at, for example, how is research starting to affect change in different organizations? You know, we can look in just the last few years. So, for example, in 2017, the U.S. Veteran Administration added EFT onto their list, approving it as a generally safe therapy.
Great.
That was 2017.
Great.
The next year, 2018, another breakthrough in the UK. So the National Institute of Health and Care Excellence, they, for the first time in their history, recommended EFT as worthy of government research funding for evaluating EFT for trauma and PTSD.
Okay.
So that was huge. And later that year also, the College of Registered Psychotherapists in Ontario, Canada, included EFT as a somatic-based approach, as being credible and effective for their registered psychotherapists. So we are seeing this kind of acceptance of EFT on more formal levels. We just this last year also saw EFT being approved in France at a university medical school for inclusion of being taught as a complementary intervention. So, you know, I expect them to continue to change. And so those are big. You know, I thought I would highlight a few studies, though, that were important that people could be able to use.
Yeah, I think it's important. Even if, I mean, doing a whole talk on science gets boring for most audiences. But if you just memorize one, like one powerful one or a couple of them, or one that you can put on a PowerPoint slide, for instance, I think that really adds some punch and depth.
Yeah. So one of them that I would say was really a hallmark beginning one is called The Effects of EFT on Stress Biochemistry by Church and Yount and Garrett and Brooks. It was in the Journal of Nervous and Mental Disease. And this one was done in 2012. And what was really different here was we always talk about EFT as being effective for stress, right? Because stress associated with pretty much any topic is if you can reduce your stress level with regard to my money or athletic performance or my headaches, etc., then it can have a clinical change, right, in real life.
It's an easy bridge.
It's an easy bridge for explaining. But stress is not just like some amorphous emotional concept. It can be measured. It can be measured in cortisol levels, which is a primary, one of the primary stress hormones. So this study showed that within an hour of EFT, a significant decrease in cortisol levels, as measured by salivary cortisol, by 24%. So this was a real breakthrough that we had to be able to demonstrate EFT really showing to be effective on an objective measurement, not just how somebody feels. Now, that's huge and that's great. I'm going to let you know that hopefully sometime in the next month or two or three, that there was then a study that was done, led by Dr. Peter Stapleton, as a replication study, because anybody can have one study that showed up well, but it needs to have consistency and replicatability, right?
Needs to be replicated.
Right, it needs to be replicated. And she did that in 2019.
Okay.
Now, it's been done. It hasn't been published yet. It's coming soon. But there was a lot of concern. Was that 24% going to be shown to be consistent?
Right.
Yeah.
Because that was powerful enough.
It was powerful enough. The results that were released by her this last year at a conference in Australia showed that EFT reduced cortisol by, drumroll, 39%.
That's incredible.
In that study. So that one's not yet released, but it's really important. And that's a great foundation, I think, looking at that. So that's one. The next one is there have now been several studies on EFT for gene expression. Okay, so I'm not going to go deeply into that, but basically, when we start to look at epigenetics and whether genes express or don't express is very important because that's happening constantly for us, and it's affecting many areas of our health. So Maharaj did a study called Differential Gene Expression After EFT, and that was post one session. And she found 72 different genes to differentially express regarding genes associated with, now get ready for this, suppressing cancer tumors, the regulation of type 2 diabetes insulin resistance, antiviral activity, neuroplasticity, immunity versus opportunistic infections, enhancement of male fertility, and more. So we're looking at the potential for EFT to be affecting on a daily level what genes are being expressed or not expressed, and EFT to have a role in that. So that has huge implications right there. Okay. And I would say if I had to label a third one, it was the EFT veteran PTSD study that showed that in 10 sessions or less, a 53% reduction in symptoms related to PTSD that then continued for 6 months. Now, we have several studies for PTSD, some that show these kinds of significant reductions in 6 sessions or less. So when we start to look at, post-traumatic stress disorder is a big concern in our culture these days, that we can start to look at EFT to be effective for PTSD as well as a variety of other anxiety and fear and phobia related conditions, that these are big, right? So nothing to shy away from.
No.
And yet I also want to caution listeners.
Yes.
I want to caution listeners with how they use these studies.
I know.
So
we've seen some stuff out there on the web that I couldn't believe people were making claims that were completely unfounded, and that's what makes us look like quacks.
Right, and I don't think it was meant to be...
no, it was just lack of education.
Yeah, and how you word things.
Sure.
So, for example, could you use all that fabulous information that I just spoke of and says that EFT is proven to be effective for? No, there is no proven to be effective for. We have to be careful with our words that say EFT has been documented to be effective for in certain cases, that there is research supporting EFT in these arenas. But please do not use the word proven. Because no one study proves anything. Right?
I also think that it also depends on your licensure and your scope of practice. So for example, I was part of that original EFT for Veterans study. I was a clinician for that. And even though you wouldn't see me writing on my website that I help people with PTSD, right? Because I'm an unlicensed EFT practitioner, and there's a big difference between that and being a licensed mental health care professional.
Yeah, you want to arm yourself with ammunition. I mean, that's one of the reasons when we did the Science of Tapping, that if you are a member of that site, we actually produce an update every quarter, a white paper that has every tapping study that we can find continually updated. And you can share that information and let it speak for itself. Right? Without having to say and be confused about it proves this or it proves that. And I also want to say that if you're not kind of a science geek, don't try to go there and just say, you know what?
It's me.
There is a lot of growing EFT research. And if you're speaking to a doctor or something saying, look, that's not my thing. I can't describe it that accurately. But tell you what, I can give you resources. I can give you this white paper of list of studies. I can point you to websites, etc. And a wonderful one that we also created was scienceoftapping.org, which is a great resource to be able to send people you're trying to impress to. That doesn't have a lot of salesy stuff. It just has the top line EFT studies, EFT in the news and reputable sources. So we're trying to create resources so people can practitioners can use the science and communicate it effectively to affect change and acceptance.
Yeah, brilliant.
Yeah.
I think that's all we need to say.
I think there's a lot more we could say,
We'll be back. We'll be back on the science for sure. We will have another episode down the road with more updated things. Let's talk about where we're going to cover next.
Yeah. So our next podcast, because we say, and remember in that definition, that EFT can be used both for self-help and self-regulation as well as clinically with a practitioner.
Sure.
We're going to be focusing on EFT as a self-help modality.
Yeah. So EFT for self-help.
Yeah. Good.
Sounds great.
See you then. Thanks for joining us today at EFT Nation. And remember that you can find show notes and previous episodes at EFTtappingtraining.com.